everyone, my name is Elizabeth and today I will be completing a detailed head-to-toe assessment on a patient admitted to an adult cardiac telemetry unit. For the purpose of this scenario, my patient is a 62-year-old male who was admitted with acute decompensated heart failure with a newly reduced ejection fraction of 30%. The patient has significantly improved following IV diuresis and is now preparing for discharge. During this assessment, I will be explaining what I'm doing, what I am assessing, and why it is important for this particular patient. I will also incorporate the FICA spiritual history tool to assess sources of strength, support, and spiritual needs that may influence his care. Hello, can you please tell me your name and date of birth?
Stephen Michael St. Clair, June 2nd, 1964.
Can you tell me what year it is?
2026.
Can you tell me where you are?
Lovelace Hospital.
Perfect. And can you tell me what brought you into the hospital?
So I was having problems. I live in a 2-story house and I was having problems going up the stairs. I was losing my breath and then I noticed swelling in my feet. So I came to the hospital and they diagnosed me with heart failure.
Perfect. So the patient is alert and oriented to person, place, time, and situation. His speech is clear and appropriate. Mental status is an important assessment to make in a cardiac patient specifically. Any acute change in cognition can indicate decreased cerebral perfusion or hypoxia. Are you having any pain, Mr. Sinclair?
No, I'm not.
All right. Now we'll be assessing for any neurological deficits. I'm going to look at your pupils now. Pupils are equal, round, and reactive. Can you raise your eyebrows for me? Can you give me a smile? Can you stick out your tongue? Perfect. Can you squeeze my fingers? Can you push down your feet like a gas pedal? Perfect. Can you bring your toes towards you, toes to your nose? Nice. So pupils are equal, round, and reactive. Strengths are equal bilaterally, both in the lower extremities and the lower extremities and upper extremities. Oral mucosa is pink and moist, and there are no signs of stroke, luckily. So I'm going to be assessing for your breathing and listening to your heart and lungs. Please take slow, deep breaths with your mouth every time I move my stethoscope. So breath sounds are clear and equal bilaterally with no adventition sounds. In a patient recovering with acute decompensated heart failure, I would pay particular attention to any crackles at the bases of the lungs, which can indicate persistent pulmonary congestion. I'd also monitor for increased respiratory rate or decreased oxygen saturation, any dyspnea or increased work of breathing. Next, I will perform a focused cardiovascular assessment. I'll auscultate for any major cardiac areas in the diaphragm using my stethoscope. Upon assessment, heart rate, rhythm, and heart sounds, including S1 and S2, are normal and present. For a patient on a telemetry unit, I would correlate my physical findings with the patient's telemetry rhythm. I'm going to assess for circulation to the extremities. Just gonna feel your pulses on your wrist here. Pulses are present and equal bilaterally. And cap refill is less than 2 seconds. Upper and lower extremities appear warm and appropriate in color. I will be assessing for lower extremity pulses, pedal pulses, and dorsalis pedis are and popliteals are all palpable bilaterally, and there is no significant lower extremity edema. All right. So, Mr. Sinclair, you mentioned earlier that this has been a major adjustment and that you're a little worried about going home. If it's okay with you, I'd like to ask you a little bit more about what has been helping you get through this.
My family and my faith.
Are those things important to you when you're making decisions about your health?
Yes, especially my family.
Thank you for sharing that with me. I'm using open-ended language rather than assuming that spirituality means religion. FICA allows the patient to define what provides meaning and strength for them. How important is it to you, is that to you when you're dealing with making healthcare decisions?
Very important.
Do you have a spiritual, religious family or other community that provides support for you?
Yes, within the church.
Is there anything you'd like us to do while you're here to better support what's important to you?
I think if you were to bring my daughter in to go over everything before I leave, that would be appreciated.
Awesome. Yes, we can definitely have her come in or speak to her before we do some discharge education, if that's okay with you.
Yeah, of course.
All right. All right, next I will assess the abdomen. I will inspect for contour, symmetry, distension, or visible abnormalities. Auscultating all 4 quadrants and bowel sounds are present. I would lightly palpate for any tenderness, hardness, or masses. Abdomen is soft, non-tender, and non-distended. Have you had any nausea, vomiting, constipation, diarrhea, or changes in appetite lately?
No.
All right. I'm going to ask you a few questions about urination. Are you having any pain or difficulty urinating?
No.
Have you noticed any major changes in how often you're urinating?
No.
Okay. For this patient, urine output and fluid balance is particularly important because the patient was treated with diuresis for fluid overload. I would review intake and output, daily weights, and renal function, as well as electrolytes, along with my physical assessment. I will also assess for symptoms related to diuretic therapy, such as dizziness, weakness, and review any lab trends, such as potassium or renal function, as clinically appropriate. Next, I will assess for mobility and function status. Can you raise both your arms for me? Perfect. And can you lift your right leg? Perfect. And your left leg? Range of motion and strength appear equal bilaterally. All right, this completes my physical assessment. Before I finish, is there anything else you're worried about or anything you would like us to know as we're preparing for you to go home?
No, just having my daughter come in. Other than that, I think I'm good to go.
Yeah, absolutely, we can. Following this assessment, I learned that a comprehensive nursing assessment extends beyond physical findings. Physically, my patient is improving, is following his treatment for acute decompensated heart failure. However, integrating FICA allowed me to learn more about how the patient is coping with his diagnosis and what sources of meaning and support are important to him. This information can influence nursing care by helping me individualize communication, and education, and identifying whether the patient would benefit from additional support or any additional referrals. One thing I felt I did well was integrating the holistic questions into the existing conversation instead of abruptly stopping the physical assessment to administer a separate questionnaire. I used the patient's concern about going home as a transition into asking what has been helping him cope. One area I could improve is becoming even more comfortable allowing silence after open-ended questions. As nurses, we can become accustomed to moving quickly from one assessment to the other. Holistic questions sometimes require us to slow down and allow the patient time to think and to respond. Overall, I felt very comfortable assessing the patient's physical needs because head-to-toe assessments is something that we regularly do in cardiovascular patients. I perceived that the patient was comfortable with the holistic assessment. I did explain why I was asking, asked permission to continue, and I used open-ended language, allowing the patient to decide how much they wanted to share. In future assessments, I would continue integrating holistic assessment into the natural conversation rather than treating it as a separate task. I would also continue using information identified during the assessment to guide any education or interdisciplinary collaboration or any follow-ups or referrals needed. Overall, this experience reinforces that a comprehensive cardiac assessment should evaluate not only how the person's heart is functioning, but also individual factors that may influence how the patient experiences illness, participates in their treatment, and manages their overall health after discharge.